Okay, I want to give a pretty good example of a peroneal neurography study done on a 1 Tesla magnet. First of all, the region that we're covering basically is from the distal thigh to the proximal lower leg. So this coverage is pretty good. And we tend to rely on this sort of large field of view coronal image in a way to help us localize what level we're talking about when we find abnormalities on the axial images. So this isn't really very diagnostic for us, but it is useful for us for localization. And what you can see here on this coronal image is a structure that's coming down and bifurcates, one thing going medially and one thin thing going laterally. This is the sciatic nerve bifurcating into the tibial nerve and the common peroneal nerve, which you can kind of follow out to here. And we'll look at those on axial images. Okay. So for example, here we are higher up in the thigh on axial T1. Field of view is pretty good. We're really just focused on the one side. Here's the sciatic nerve. As you follow it, as we scroll down, you can see the nerve splitting up at this level, and it's kind of we're starting getting into the metaphysis of the femur. Tibial nerve going with the vessels, common peroneal nerve coming out here. Now at this point, because of coverage issues, a second sequence was obtained. Okay, so we can go back. We're probably already a little too far posterior, or too far distal. But here's the tibial nerve. Here's the common peroneal nerve. Here it is, coming out the side. Common peroneal nerve comes along the fibular neck, wraps around to the anterior compartment, and so sometimes we see denervation changes on fluid-sensitive sequences or on this in the anterior compartment. This is a really good range that was covered. So we really can see this area especially because this is where the nerve tends to get impinged, and we can see those muscle changes. We do have, I think, an axial T suppression image, which, if I go back up higher, it's very hard to see the nerve. It's in this area here, but it's minimally bright, but it's the area that we're looking at. We're looking for signal changes in that nerve, as well as masses along its distribution and the changes of denervation. Anyway, this is a great example of a well-done study of peroneal neurography.